So I'm going to go ahead and show you guys how specialty care works. So the caveat to specialty care is that you do need to make sure that you have initiated the care that you want to manage from either your work list or your MAR. So for example, with this patient here, I put in IVs, I did a set of vitals, I did the assessments, and I put in an art line for that patient. And I did documentation on those things from the work list to initiate that part of the care. And then I went over to my MAR as well. And within my MAR, I also initiated some IV fluids and a norepi drip and a couple of things here that are already sort of up and running for the patient. So I wanted to point that out to you guys because it's important to go and start those items there. Once I have started those items, then I can go to the specialty care. So when I drop down my document caret, I can hit the specialty care button, and it'll open up the specialty care option here. So now I've got a couple things already happening. So I will probably need a repeat set of vitals. I've also got some infusions going, and I've got an art line. But if you notice here, there's a lot of things on this list, and I'm finding them a little bit overwhelming. So the first thing that I'm going to do is I'm actually going to clean up this list a little bit. So what I do is I click on this items here, and I can actually remove things that I'm just not going to manage from here. So I'm not going to give any medication from here. And I will do infuse titrate, but I'm not interested in the intake and output here. I'll look for it in the chart after. Patient's neurologically stable, is not a diabetic, so I'm not going to do that. I'm monitoring my vital signs, so I'm not going to do monitor vital signs because I don't have that option right now. And he's not on a ventilator yet, but I'm anticipating he will be, so I'll bring that in later. And I can manage, I think, pretty much all those things. If I wanted to add something that isn't visible here, typically if something's already been initiated, you'll already see it here. But for whatever reason, if you want to initiate something or you want to find something that isn't there, you can go to this Get More button and then do a search for whatever it is you're looking for and bring it in, and it'll bring it up. So now you're going to notice that my list is actually fairly cleaned up. So I don't have as many things to deal with here. A little bit of a side note here. So there's a couple things. So I can manage this hourly, so I can set the time frame so that if I'm looking at hourly or 15-minute assessments, I would typically do something hourly if we were doing critical care. The other thing is if I come out of this chart and come back to it later, all that list stuff that I cleaned up here will be back. So if I want it to stay like as is, I'm going to click on this gear button here, and I'm going to save the current state. So now it's going to save this with these items on it for any time I access this chart back and forth. So that's another important little detail. So now, how does specialty care work? So it allows me to manage multiple things that I would have to be going back and forth from work list to MAR to manage in one place. So I want to do my vitals, and I want to manage my infusions. I've got norepi going, I've got ringers going, and I've also got a bolus of fluids going as well. And I've got my art line assessment that I want to deal with, and I may reassess the patient's pain while I'm sitting there. So now that I have these things open, I can do a couple things. The first thing I'm going to want to do is I'm going to reassess my patient, so I'm going to do another set of vitals. And I've determined that the temperature is still there. It will still want those little details. So you do have to make sure you click on the chevrons. If you click in the box, it'll open a text box for you. If you click on the chevron itself, it'll bring down the drop-down menus. So we'll say that this patient's heart rate is actually increasing from the previous assessment and is still regular and weak. And say that his respiratory rate, he's still not doing so great. His respiratory rate is now 30, and he's still on room air at this point. And we'll say that the blood pressure, even though we have a norepi drip going, the blood pressure is just not moving in the right direction. Let's just say that it's just slightly increasing, but not enough that is making a big enough difference. And I'm going to go ahead and select automatic cuff for that. any complaints of pain. So we did establish that the patient still has pain. So we're going to go ahead and put that in there as well. And that is acute. And we may want to give something for pain if we decide that that's a priority at this point. And then that's at rest as well. So now that I've put in my vitals, I can go immediately to managing my drip. So we started this norepinephrine drip at 0.03, and it's now been bumped to 0.05. And I'm still not getting the results I'm looking for. So what I can do here is I can now click on this dose rate field, and I'm going to go ahead and increase that to 0.1 micrograms per kilo. And you'll see here that the status is increased, and it'll account for the cumulative intake of that patient for that drip. So my Ringer's lactate now. So I had increased it to 300 from 75 previously, but I'm feeling that this patient is still needing the fluid a little bit faster. The patient was quite dehydrated from nausea and vomiting when he came in. So we're going to increase the rate of that infusion to 500 so that we're giving him that fluid a lot faster. And you're going to notice here that my bolus now it does appear that it has gone through. So I can actually go ahead and put in a container volume of 0, and that will complete that infusion. So the bolus has gone through, and I've now got this Ringer's going in much faster. The other thing I can do from here is my art line. So I've got an art line in situ. I've repositioned my patient, and I just want to double check my art line and make sure everything is good. So I'm going to select the category of maintenance here because it's already inserted. And then so I'm going to acknowledge, the details. So it's a 20 gauge, and it does have a film dressing still intact. And I'm going to go ahead and put that the pulses the auscultation for Bruey is present, and I've zeroed this art line at this point. So I'm going to go ahead and put that, and maybe I also did a line flush. Maybe I did a square wave form setup as well, or test, sorry, and I made sure that those things are there. And then if I did an NBP, was there a difference in NBPs? No, the NBPs were exactly the same. And I can sort of go through this and sort of work my way down as I would like. When I'm assessing my site, so it's within defined standards, and patient is still able to move that extremity well. I have no concerns. Everything looks the way that it should. It's normal. He's got sensation. Temperature is good on that hand. Temperature is warm and good on that hand. And I've got bilateral pulses. So I'm not concerned about that art line in any shape or form. I've already dealt with my pain assessment in my vitals section, so I'm going to minimize that. And now I've got everything that I need documented for that patient without having to move back and forth from work list to MAR. This is strictly optional. You can manage all of this from your work list or your MAR, but I find it's a pretty practical tool to have to move back and forth. So that's basically your specialty care and how you use it.